Hello everyone, I hope you can hear me. My name is Natalie Matchett and I am the interim Return to Practice lead at Health Education England. I think this morning, for those of you that have been attending the conference, you've heard a lot around our different professions within health professions, including ways and routes into them, such as work experience and how to apply to some of our courses at university and what career options that there are out there for you within the AHP professions, as there are many. But what we're actually looking at in this session is on the other side. So once you've decided on what profession you want to be, and not only have you qualified in your chosen career, but you actually might have chosen to take a career break. And that is what I'm here to talk to you about today. Those professions that you've already trained in within allied health or healthcare scientists or practicing psychologists, but you have since left the profession and therefore the HCPC register, and you now want to return back to practice. Now, the HCPC stands for Healthcare Professions Council, and they're our regulatory body, and they protect the public, and they keep a register of all our health and care professions. And we'll have to register onto there once we're qualified to declare that we have undertaken the necessary academic qualifications and have the appropriate professional knowledge and skills. And it almost is a declaration that we're fit to practice, we're ready to treat our patients, and we meet the HCPC standards. So that's what I'm here to talk to you about. We run here at Health Education England a programme that can provide help and information if you want to return back to practice, as during the course of your career, you may not practice in your profession for a period of time. This may be for many reasons, and it can include you going out there to travel, you might have some caring responsibilities, or take parental leave. But I'm hoping that it's great for you to know that you will have the support throughout the whole timeline of your healthcare career, right from being a student through university to being newly qualified, and down the line when you're an expert and you're an advanced practitioner. We do invest in you. So hopefully some of you will want to come back to your profession and resume practicing, which is why we've got this process. Here at Health Education England, we've got a national return to practice programme, and that's designed for anyone returning to practice that needs to just refresh their knowledge and skills and complete what we call a period of updating, which is a HCPC requirement. And what we do is we help support you with clinical experience, academic support, and financial support, which I'll go on to explain. But what you can see here, you only need to complete the return to practice process if you've had a break in your career of more than 2 years, and then the amount of updating increases the longer that you've been out of practice. So you can see below, if you've had a career break for more than 2 years, it's 30 days, and if it's over 5 years, it's 60 days of updating your knowledge and skills. And that's the requirement to rejoin the HCPC register and therefore your profession. And I'm going to talk about what updating entails in a moment. Just very quickly, just to point out, some of you may be aware that there is a HCPC, temporary register at the moment. Now, this is different to the return to practice process, but some of you may have been contacted by the HCPC and have been placed on the temporary register. And that's for those that haven't practiced in the last couple of years, and you've automatically been put on the register for those that want to assist during the pandemic. But just be aware this is temporary, and for those of you that do want to return to practice once this temporary register is closed, you need to continue with the return to practice process that we're speaking about today. And also to let you know that as a good thing really, for those of you, to give you some reassurance, for those right now that are thinking about rejoining your profession despite these challenging times, still continuing to support your return to practice during COVID. And the HCPC have acknowledged that and some of those difficulties and challenges at the moment. And they've changed some of their requirements to allow some more flexibilities. They've changed their timescale, for instance, from 12 to 24 months to allow you to complete your return to practice journey. And they've also changed some of the evidence that they'll accept as your knowledge and skills of updating. So many of you will know that, for instance, some outpatient clinics that are running, perhaps by a physiotherapist within an NHS trust, there's in telephone clinics via Microsoft Teams. What the HCPC are allowing now is for you to join in on and shadow and participate in those virtual clinics from your own home environment so that you can still update your knowledge and skills without necessarily going into an organisation if there's any struggles from organisations at the moment in providing those experiences because of the pandemic. So back to return to practice then. The requirements are really flexible and it's aimed to allow you to refresh your knowledge and skills through a very self-directed process. And it's there for you to decide, and it's for there to suit your own learning needs in a way for you to return that suits your personal circumstances. You already have the knowledge and the skills and experience to make a difference for our patients, our carers and their families. And what we do is we just want to help you on your return to practice journey. So it really is led and directed by you. It's you that creates your own plan and decides if you're competent and when you're ready to return back to the register. It's you that declares that self-competency after you've had your period of updating and collecting and submitting your evidence and hours that you've done to refresh to the HCPC for them to assess and process. So no one else gets to decide if you're competent. It really is down to you, and with, of course, our support. What you can see there, that any considering to return to practice, is there is a period that I've been speaking about of updating. And this is what updating entails. So you can see that the HCPC advise different activities, which can be a mix of supervised practice, and that's often undertaken in a clinical environment, and support from someone who is supervising you from your profession. And that is a very popular method for updating for a lot of our returnees. The next one is formal study, and that's often a formal certified course that's relevant to your profession, often provided by a person or organisation such as a university or your professional body. And then the last one, private study, and that involves more informal learning, your own reflections after reading a book or a journal, looking at some websites or podcasts. And the only stipulation is that they say that private study can't make up for more than 50% of your updating. You can see there that we also provide funding, which I've mentioned, of up to $1,300 for each returnee. And that includes costs towards the formal courses that I've mentioned, out-of-pocket expenses for travel, childcare, uniforms and books, for instance, and for those that are undertaking supervised practice as part of their updating, those that go into perhaps an NHS trust, your supporting organisation that is giving you that opportunity, they can also claim as well. All we ask is that they are part of commissioned services, NHS, social care and charities. At the moment, we unfortunately can't provide any funding to the private sector, for example, for those that take a practice placement within our private sectors. Here, I won't go through this busy slide, but it's just to let you know that the programme does have some eligibility criteria, and it's and we support those that have qualified within the UK as AHPs, healthcare scientists and practice psychologists that are living in England and need to update their knowledge and skills that we've been speaking about for those that haven't practiced for the last couple of years and are looking to get back into a health, education or social care sector. It's not open to those who have qualified abroad, that have never registered with HCPC before or have a fitness to practice issue. So why should you join? As we've mentioned, And hopefully you can see there's a wealth of access to support and guidance from myself and the team that includes the funding that I've spoke about. Also, we help you find supervised practice placements. We can help signpost to local organisations, and then we're really encouraging them to support our returners. And they can work with you to gain your relevant knowledge and skills. And some of you can be employed by them, so earn as you're refreshing, as well as having voluntary pay placements as well. We've also got access to a closed Facebook page for you, and that's a real great source of peer support of other returnees in your situation for you to share your experiences with each other. Really, to finish from me, before I go on to my panel, just to summarise some of the aims, we really are trying to work hard to support you to return to practice, but we're also working with your professional bodies, the universities, NHS and AHP managers and social care and charities to promote return to practice and the benefits of having returners. And obviously working with all of you that this may apply to right now or even in the future if you take a career break. We want to get return to practice on everybody's agenda. And again, you'll hear from those in a moment on our return to practice panel about their lived experiences. And it's so important that I think that we think about returners as a way to support our NHS, our recruitment and retention strategies. Many of you will know it's high on the agenda at the moment about our vacancies within our allied health professionals. And our return to practice, they'll really help fill those vacancy gaps and help meet those workforce plans. So hopefully, this slide, a little bit busy, but we've had great engagement and outcomes already. So the programme has actually supported over 450 people back to the register, and that's the top line, the total in green. We've had over 477 enquiries since we started, and that's the yellow. And then we've also, at the moment, right now, we've got 333 of you who are actively completing their return to practice journeys as we speak. A bit of further data. The majority of people who are returners are female. The average age is 44. The oldest is 62, and they are back on the register right now. The youngest is 25. So that makes the average age between 40 and 49. And if there's any AHP managers listening right now, what an ideal opportunity to have a returner to address those workforce issues. Those vacancies. They've got such a wealth of knowledge and expertise, our returners. We're working on developments all the time. We're looking at things like funding and really streamlining that process to make sure that you get your out-of-pocket expenses quicker. We're working with some universities to design specific return to practice programs that are online and generic across all the professions instead of being profession specific. We're doing webinars like this one to promote return to practice, and we've launched some new videos and case studies. You'll get to see the lived experience of, again, returnees next from our panel. We're working hard to dispel any myths out there about return to practice. So we're trying to work hard with organisations so that we can dispel myths around that they can see patients, they can be in voluntary roles, employment, they can be in support worker roles. They're not there to take any new exams, they're not there to retrain. They already hold a qualification. These are qualified expert practitioners. Return to practice is about gaining re-registration to the HCPC so they can use the protected title. These are not students. Often within organisations, they're placed on honorary contracts, they're supernumerary and under the supervision of qualified practitioners, which means that they can treat patients and they're covered by the necessary insurance. So they've got, they've got so much knowledge and skills, our returners. They really can make a big difference to our patients. So to finish, and how you can help, for all of you out there, please engage with our programme and the National Return to Practice team and do get in touch. If any of you are organisations that are listening and can offer support to our returners by providing them with a clinical placement, please get in touch. Any managers out there and you want to know more, if we can help you set up the process or contracts, we're happy to come out to you. And of course, if you're someone right now out there that wants to return back to practice, You'll see our webpage, other information on this page in front of you now, and also our virtual booth that you can all access. Do get in touch. But thank you for listening, and we hope to hear from you. And what I'm hopefully going to do now, without further ado, is introduce you to our panel of returnees. Hello, everyone. So what I'm going to do is move to our panel, and I'd love to welcome our panel today, Sandra, Morag, Faith, and we've also got Paul Chapman, who was the founder of our Return to Practice programme and former lead, and hopefully his expertise and wisdom, we might have time to chat to him in a moment. But without further ado, I'm going to ask the returnee panel in turn to give a brief introduction of themselves, their role, how long they've been out of practice and what's made them return. And hopefully you get some top tips. And if we can start with you, Sandra.
Yeah, thank you. Welcome, everybody. Hopefully we've got plenty of people on here who are looking to come back into a profession that they once knew and would love to return to. My story is I qualified and practiced physiotherapy in the 1990s. I then finished because of childcare, and I wanted to bring my children up full time. So I did that, and I expected to get back into physiotherapy as soon as they were at school. And that ended up proving much more difficult than I thought it would at the time. You're talking sort of 2005 kind of time. And it was much more difficult than I thought. So I had a career change out of physiotherapy completely, expecting not to be able to get back in. And I went into a franchise business. I did some events management. I've ended up, for the last 6 years, I've been leading a charity in their operational department. So I've done a whole load of other things. But a couple of years ago, my mum had a total hip replacement. And as part of her just being with her as her family member, I realized that there was loads of stuff that I was saying to her, that I was helping her set up in the home to make it easier for her, that just was not general knowledge. And I thought it was, but it wasn't. It was specific knowledge to physiotherapy. It was, and it started my journey of thinking, do you know, maybe this is simply in my blood, and I can't get rid of it, even if I do go on to another career, because it's just who I am. So it started a journey. I wasn't sure where to begin. So my first port of call was my professional body, the CSP, and that ended up being a place where I found some signposting, and that's what really started things off to me to know where to go. I attended a national conference and just got speaking to people because I'd been out for a while, so I didn't know anybody currently in the physiotherapy profession. So I made myself get out there and find some people and speak to them. I took a week's annual leave and volunteered in a hospice to check that this wasn't a fluke, and I really did love it. And I was bowled over, not just by how easy it was for me to fit back into that setting, but just how amazing and back in love I fell with rehab. So I ended up checking with the HCPC with how much updating I would need to do. And because it was over 5 years since I'd been out, I had 420 hours to complete. So after an incredibly long gulp, thinking, how on earth do I do that? That's the equivalent of 3 months full-time work that I had to complete. And I didn't know where to start. That was kind of like quite scary, but I thought, you know what, I just can't get rid of this feeling. I will find a way. I will work out what I need to do. And at that point, I became aware of Health Education England's programme for Return to Practice. And I must admit, if I hadn't have found them, I'm not sure I would have been where I am now, but they are phenomenal. So I would recommend to anyone, get in touch with Health Education England. The Return to Practice programme is where you will get support, you will get advice, you will get help. We've got a closed Facebook group, we help each other. There's a real community out there of like-minded people who can just reignite that passion, but help you get that placed. So I'm currently a third of the way through my updating hours now, and am in process of arranging with a local trust my honorary contract to do some supervised placement. I've done a third of my hours in formal study and private study, and they have been great, but you know, there's nothing for me that beats being there in the setting with the people, seeing the conditions and the challenges that people face and finding the solutions. So that's been my passion. That for me, I didn't only want to do private study and formal courses where I could get certificates, but so I've really pushed for getting in touch with clinical leads and putting them in touch with each other and HR and all of those kind of things to push my progression through to get a supervised placement.
Thank you so much, Sandra. It's so wonderful, and it really brings to life and provides that real, true, rich and real experience when we hear from you with your wealth of information. I'm not sure if we've got time to hear from, I'm hoping we have, from Morag and Faith very quickly to finish. Is there any hints and tips you'd like to just put as our parting finish to anyone out there that's thinking about returning?
I think resilience is really important. I think with COVID, you know, it's tricky. It's taken me 8 months to get a clinical placement. In terms of accessing knowledge, in some ways, COVID made that easier because courses were very much online, and a lot of companies were sponsoring webinars. So those were fairly easy to access, but it's been for me the clinical placement that's been difficult. And that's where the return to practice programs really helped me, because one of the regional AHP leads has really supported that and put me in touch with a lot of departments. So I've been in touch with about 8 departments. So I've done a huge amount of updating. I'm like Sandra, I've got the 420 hours to do, but I'm about 3/4 of the way through now, and I've got a few weeks left of the clinical placement, which I started a few weeks ago, and the team have just been fabulous, supporting me, you know, welcome me back to something that I'm passionate about and that I love. So my main tip would be keep going. You know, as Sandra says, you have these skills, you have this passion, you know, work with those that you can go to for networking and for support. Thank you
so much. No, thank you. And lastly,
so I guess I'm slightly different in the sense that I didn't actually ever stop practicing as a dietitian. I just had a break from the NHS and went into sort of the media and industry, and was lucky enough to be asked to go back and help during COVID, which really sort of lit the fire in my belly. And I think one thing I would say is that regardless how long you've had out of the NHS and whatever you've been doing, I think it's really, really important to realise that you will have absolutely learned additional skills which are definitely transferable. You know, I think coming back into the NHS, I've come into it with a whole different perspective, a different level of appreciation for the NHS as an employer, and what an amazing place it is to work, where you are, I think as Poole said in his last presentation, every day is a school day. You have an amazing opportunity to learn from really inspiring, exciting people around you every single day, as part of a dynamic team, and you just don't get that working privately. And for all of the other benefits that you know, you might think that private work has, you don't have that team and the inspiring people around you. And certainly for me, that's been a complete game changer. And I'm back in a busy department who have been unbelievably supportive. Yes, I walked in absolutely terrified, thinking, I'm sure I've forgotten loads of stuff, but actually it comes flooding back, you know, and I'm just loving it. And I'm loving it because I had that time out. So anyone who has been out of the NHS is thinking about coming back, just do it, because it is amazing. And I think that when you go back into it, you realise what an incredible place it is to work. So yeah, my tip would be you've definitely got transferable skills. The time has not been a waste of time. You've learned so much, and you'll be a better dietitian or physio or whatever because of that time out.
I love that positivity at the end. Just do it. Thank you so much to all of you, all our returnees, for joining us and supporting this session and giving such important insight and feedback about your experiences. And I'm hoping that if that doesn't inspire you, what will? And as mentioned, if anyone wants anything further from today, please visit our virtual booth or our HE website for Return to Practice for any further information. But to end that again, a big thank you to Carrie Biddles for inviting us and the conference team. But most importantly, thank you again to Sandra, Faith and Morag. We wish anyone out there that wants to return all the best. Those that are returning currently, all the best. And those that have done it, good on you. We're lucky to have you within the AHS. So thank you, and I hope to hear from you all soon.